Hey everyone, and welcome back to The Broken Shift, your favorite dose of unfiltered healthcare reality. I'm your host, and tonight we're diving into something that could literally change your life, or at least make your next trip to the emergency room a whole lot less chaotic. We've all been there, right? The bright lights, the constant beeping, the feeling that you've just walked onto the set of a disaster movie. It's stressful for you, and trust me, it's just another Tuesday for us. But what if I told you that you hold the power to make the whole experience smoother, faster, and more effective? Today, we're pulling back the curtain and sharing the top 5 things your ER nurse is secretly, desperately, wishing you would do before you even walk through those sliding doors. This isn't just a rant. Okay, maybe it's a little bit of a rant, but it's packed with advice that will help us help you better. So, grab your metaphorical stethoscope and let's get into it. First up, and this one is so simple but so often forgotten, bring a list. I'm not talking about your grocery list, although if you're having a heart attack, maybe just leave the milk behind. I'm talking about a list of your medications, your allergies, and your medical history. When you arrive, especially if you're not feeling well, remembering the exact dosage of that one little pill you take for your blood pressure can feel like trying to solve a Rubik's Cube in the dark. We're going to ask you, probably multiple times. The triage nurse will ask, the primary nurse will ask, the doctor will ask. It's not because we don't listen, it's for your safety. Writing it all down on a piece of paper, or even just keeping a note on your phone, is a game changer. It prevents dangerous drug interactions and saves us from playing a high-stakes guessing game. Seriously, your name, date of birth, medications with dosages, known allergies, and major past surgeries, or conditions like diabetes or heart disease. That little piece of paper is worth its weight in gold. It's the VIP pass that helps us get to the root of the problem faster. Number 2 on our wish list, learn to tell your story. And by that, I mean describing your symptoms clearly and chronologically. When we ask, what brings you in today? An answer like, I just don't feel good, is the medical equivalent of telling your mechanic the car is making a sound. We need specifics. Think of it like you're telling a detective story, and the main character is your body. When did the pain start? Was it sudden or gradual? Where exactly is it? Does it radiate or move anywhere else? What makes it better? What makes it worse? On a scale of 1 to 10, how bad is it? And please, be honest with that scale. A 10 out of 10 pain usually means you are incapable of calmly scrolling through TikTok while you tell me about it. Describing it as sharp, dull, achy, burning, or crampy gives us huge clues. The more precise you can be, the faster we can connect the dots and figure out what's going on. A good story helps us order the right tests and get you the right treatment without delay. We're not mind readers, though some days I wish we were. Help us help you by being the best historian of your own body. All right, let's talk about the elephant in the room. Number 3, please be cautious with your Google diagnosis. Look, we get it. You have the entire medical world at your fingertips, and it's tempting to search for your symptoms. A headache and a tingly finger suddenly turns into a rare, incurable brain disease, according to the internet. The problem is, Dr. Google doesn't have a medical degree, and it definitely doesn't know your personal health history. Coming in and saying, Google says I have XYZ, so I need this specific scan and this specific medication, can actually work against you. It can create a confirmation bias, where you might unintentionally emphasize certain symptoms and ignore others because they don't fit the diagnosis you've already decided on. This can send us down the wrong path, wasting precious time. It's absolutely okay to do your research and be an informed patient. We love that. But come in with an open mind. Tell us your symptoms first, and then, if you want, you can say, I was worried it might be this. Let us do the diagnosing. We've spent years training to sift through the information and rule out the scary stuff. Trust the process and trust your team. Moving on to number 4, and this is a big one, especially for those late-night visits. Before you show up at 2 a.m., for something that's been bothering you for 3 weeks, ask yourself one simple question. Is this truly an emergency? Now, let me be crystal clear. If you are experiencing chest pain, shortness of breath, signs of a stroke like facial drooping or weakness, uncontrolled bleeding, or a severe injury, get to the ER immediately. We are here for you 24/7 for true emergencies. However, the ER often gets clogged with issues that could have been handled much more efficiently and cheaply at an urgent care clinic or by your primary care doctor. That rash you've had for a month? The prescription refill you forgot to call in? The sore throat that just started an hour ago? These things, while uncomfortable, are generally not life-threatening emergencies. When the ER is filled with non-emergent cases, it creates longer wait times for everyone, including the person having a heart attack in the next room. It stretches our resources thin and adds to the chaos. Many insurance providers have a 24-hour nurse hotline you can call for advice. Using urgent care or your regular doctor for non-emergencies is not only better for the healthcare system, it's better for you. You'll likely be seen faster and get more focused care for your specific problem. And finally, the most important thing your nurse wishes you knew: honesty is your best medicine. This is number 5, and it's non-negotiable. We are not here to judge you. We are not law enforcement. We are here to keep you safe and make you better. We need to know the truth, the whole truth, and nothing but the truth. Did you take any drugs? How much did you really drink? Did you actually take your medication as prescribed? Did you fall, or did something else happen? We've heard it all. Seriously, nothing you can say will shock us. But withholding information can be incredibly dangerous. If you don't tell us about that one herbal supplement you're taking, it could have a life-threatening interaction with the medication we give you. If you're not honest about your alcohol consumption, you could be at risk for severe withdrawal, which can be fatal. Your secrets can actively harm you in a hospital setting. We have a professional and ethical duty to maintain your privacy. Our only goal is your health. So please, leave the embarrassment or fear at the door and just be straight with us. We are on your team, but we can't play the game effectively if we don't have all the pieces. So there you have it, the 5 things that will make you a rockstar patient in the ER. To recap, bring that all-important list of meds and allergies, practice telling a clear and chronological story of your symptoms, use Dr. Google wisely but with an open mind, consider if your issue is a true emergency or better for urgent care, and above all, be honest with your care team. Following these tips won't just make your nurse's life easier. It will result in faster, safer, and less stressful care for you. We went into this field to help people, and when we can work together as a team, everyone wins. Thank you so much for tuning into The Broken Shift. I hope you found this helpful, and maybe even a little entertaining. What are some of the wildest things you've seen or heard in an ER? Drop a comment below. Nurses, I know you've got the best stories. And if you want more real talk from the front lines of healthcare, make sure to hit that subscribe button and ring the bell so you never miss an episode. Stay safe out there, and here's hoping your next ER visit is a long, long way away. Until next time.